everybody. Welcome. We're glad you're here. And I'm going to let Ainsley introduce herself this morning, and I'm going to start us with a word of prayer. But I just want to say this is an example of one of us saying, you know what, I'll lead a class on such and such. So I would love it if you all have a passion or have something that you would be willing to share your wisdom about with our community. And we're really, really grateful to Ainsley for doing just that, for saying, you know, this is what's going on in my life, and I'm happy to share how this works and how my faith sort of intersects with it. So let's pray. Good and gracious God, we thank you that we can be gathered as your people in this way, in this fashion, in this community. And I pray that we will be able to hear a word from you as we learn more about the changing dynamic in healthcare and through AI and what that looks like for our own daily living. Anoint Ainsley with your spirit as she speaks, that she would reach hearts and minds in ways that lead us to greater awareness of your presence in our midst. In Christ's name we pray. Amen.
Amen. Thank you so much, Emily. So nice to be here. I think I'm going to take a page out of Emily's father's book and just start by saying I really want this to be a conversation between all of us and a discussion. So I'll leave plenty of time for that and to ask questions, and just know there's no wrong answers except throwing tomatoes at me as someone said they were going to do. Although I love a good tomato though, like a good salad. So it's so great to be here, and I was actually thinking during services, like, you know, how does AI relate to spirituality? And it's something I think about a lot. But one of the things I was just struck by is that period in which we reflect on a lot of us who have family members who need our prayers, and just how much each of us is really impacted, right? When we have a sick family member, or when one of us is sick or passes away. And so it was a good reminder of me of how the work that we're doing in this space really has, you know, true meaning and can make a true difference. So I think what I'm here to share with you all today is that AI has been around for a long time. There's been a lot of excitement in the last 2 years due to generative AI, which is sort of that ability to create words. And we really are in what's being called a mega trend. So AI is not going away. It's like electricity or the printing press or the World Wide Web. And so it's really here to stay. And at this point, it's embedded almost within everything we do and will be for a long time to come. So it's not anything to fear or to kind of question, you know, is it real? But it's something like anything else where it's normal to be, you know, wondering like, what is the huge impact that this is going to have? But we really are at an inflection point, and not in a scary way as a society in terms of the ability that we're going to have to implement real change. And I always love to share the story. So I'm a radiologist. So I interpret images. And about 10 years ago, I was at a really large conference, and there was a gentleman who's a very esteemed professor from the Wharton School. And he said, can the radiologist in the room please stand up? And he had us stand up, and he's like, all right, now everyone wave goodbye to them because, you know, they're not going to be here. So, you know, I always have to say, anyone who's worried about their kids or their grandkids, and are they going to have a job? I'm still here. So really quickly about me. So my husband and I live on Norton Road. You may have seen us. We have a large family. We have 4 kids. My husband's Jewish. I was raised Roman Catholic, but you know, we consider ourselves Presbyterian. My dad, as you heard during services, comes from a long line of Presbyterian ministers. And I'm just so grateful that I've really met Emily. She's such a role model for me in many ways. And I'm just trying to think if there's anything else I should tell you. So we have a field hockey player, an ice hockey player, a flag football player, and a dancer. And a cockapoo and a Bernedoodle. So there you go. It sounds like a song. So as I mentioned in that so the video that you guys saw today, is it James, Emily, who does the video? Mm-hmm. So it was like filmed in front of like a dead bush in our garden, which is going to look beautiful really soon. I'm on the Memorial Garden Committee. But I said, can't you do something like kind of AI generated? So James, that was James's work. Oh my God, that was so good. Okay, we've been talking about if anyone else wants to do a future adult education and you want an AI generated background, let James know, okay? So a little bit about me professionally. So I'm a neuroradiologist by training. I went to Brown Medical School. I trained at Brigham and Women's Hospital in Boston. And I actually came down here to Kaiser Permanente fresh out of my fellowship. And I was there for about 15 years. I led radiology operations. We do about 1 million exams a year. And then in my last 2 years with Kaiser Permanente, I stepped into the Chief Medical Information Officer role. And it was one of those funny things where the chief medical information officer controls all of the technology for a hospital. So the electronic health record, we all love to hate, anything that goes in and out of it. So I was like, you know what, this is pretty straightforward. I know all the complex part, all the radiology, all the imaging. And then literally 2 days after I stepped into the role, ChatGPT came out. And I was like, okay, I quickly realized, that the trajectory of me in this role is going to have to adapt. And so I stepped into the role of Chief AI Officer, and over the last couple of years really helped Kaiser Permanente to shape what is our strategy going to be in this space. And I think everyone kind of came out of the gate, so much excitement about generative AI. We, like many organizations, were doing a ton of pilots. And then we finally said, let's step back here. What do we want to do? What's our purpose? And we finally landed on, we're going to be the largest scaler of AI in healthcare. Because what I would find when I would go to conferences is a lot of community hospitals, a lot of physicians, and even community health partners would say, how are you all using AI? How do we know what's a waste of money, what's not? And so we realized we have to do really robust sort of trials and demonstrate to the world, like, where is it a good use of your money and time? And so we actually did the largest deployment of generative AI in healthcare when we rolled out what's called an ambient scribe. And I don't know if any of you have used this yet, but when you go in your doctor, there's actually artificial intelligence that's capturing the conversation that you're having with your doctor, so they can look at you and talk to you while they're getting your history. And it's capturing it in the background. It's not just a recording, it's then turning it into a beautiful note that then files in the electronic health record. And we're now at the point within the next couple of years, well, not only will the note file, but whatever your doctor's saying out loud. So I'm going to recommend a CT scan. That order will come up for them. And then I'm going to recommend that you pick up your medication at the pharmacy. And that's all going in there. And so therefore, what's then the outcome of that? It's a doctor who can focus on you, listen to you, and maybe pick up those cues that technology can't. But one of the things that really blew me away about that was when we first started doing this, and we did this across 12 million patients, 10,000 physicians, and we're actually publishing that article. It's coming out in the New England Journal of Medicine AI in the next couple of months, was that when you do this, it's really important how you prepare people. So you have to do a lot of work in advance. You have to talk to doctors. What does this mean? We had to educate our patients. It was funny though, our patients were so excited about it. They're like, this is so cool. I can't believe I'm having AI used on it. And our doctors surprised us too. They were really, I think healthcare as a profession has been sort of humbled by this and is a good sort of example for the rest of us, because there's so many things that are broken, as you know, that need to be fixed. And I think doctors realize that more than anyone. So we did that large deployment, a lot of learned lessons from that. And I left KP earlier this year specifically with the purpose of doing what I've been doing within Kaiser Permanente outside of it. So having an even greater impact outside of our 12 million patients for the rest of the country. And so I started this advising firm that's sort of like a strategy firm, and we do thought leadership. We consult with startups, and I'll go to the next slide, just kind of talk about that. So I work with a bunch of startups, and what's been really cool is it's actually like a global network of health startups. So I work with companies. We have a client from Japan, all over Europe, of course, in the US as well, and sort of feeling like you're part of this greater. So I think something we all kind of learned during COVID, we're all part of this global network, right? In terms of trying to make things better. Of course, no surprise, everyone wants to come into the US, right? So they want to know, how can we grow and scale and show, we can make a difference in the US. So a little bit about me. I am an advisor for several startups. This is really tiny intentionally because it's not important. I'm an entrepreneur in residence at Yale Ventures, which I get the chance, I'll be going up on Thursday to meet with a bunch of women faculty who are purely academic professors, but are maybe thinking about, do I want to start commercializing what I'm doing? And so what's been really cool about AI is seeing that intersection between academics and industry, right? And then we really need, and of course, hospitals. And so we need to get to that point where those three are working together really well if we're going to have transformational change. I also sit on the board of the National Women's History Museum. We just had a big gala, and I consult with a few other venture capital funds. So I just wanted to disclose that I'm bullish on AI, but I also recognize, that it needs to really be approached thoughtfully. So I'm going to keep the slides short. But I'm going to talk about three big buckets that I want you to take away, okay, in terms of where AI is being used in healthcare. And then I'm going to give you three use cases that I also want you to take away that my firm sort of published some thought leadership on that are kind of exciting. Okay, so and if you have any questions, please jump in, but that's basically the whole of the talk, and then we'll have time for questions and answers. Okay, so the first big bucket is diagnostics and clinical decision support. So diagnostics means anything that we do, right, to get you an answer. So for radiology, that's every part of the body, right? But then it's also broader. So it's looking at skin cancer. I'm working with a company that has a device that if you put it on a freckle, ideally not a freckle, a suspicious looking mole, it'll give you the likelihood using AI that that actually is cancer. And why does that help in the community? Believe it or not, the wait times to dermatology right now are months, right? And so if a primary care physician, it's currently approved by the FDA, if a primary care physician can say, okay, this is really suspicious, a dermatologist can see you maybe in like a couple of weeks, and it can help triage. And they can say for others, we'll see you back in a year. That's low suspicion. So it's sort of making it something that's quantifiable. Believe it or not, pathologists are using artificial intelligence now. We deployed that at Kaiser Permanente, and we're seeing it more and more. That does involve slides being digital, just like radiology are. And in a lot of the United States, slides are not digital yet, right? It's still like an actual piece of slide that, right, it hasn't been scanned into a computer. But when you scan it into a computer, what artificial intelligence is really good at is looking at, say, a breast cancer slide, and then very quickly quantifying for the pathologist the percentage of, say, cells of a certain type. Or if you put a stain on it, and pathology is not my area of expertise, but you kind of stain that saying, this is more likely to be like an ER positive breast cancer that then can be treated. So you can just give you an idea of how it's helping to standardize and quantify medicine, which is a good thing. I'm always jealous of pathologists because they get to look at everything in color, and radiologists, everything's black and white. So, okay, so this is kind of this last piece, which is the clinical decision support. Is actually, I'm going to mention one more diagnostic that some of you may relate to, and that's diabetic retinopathy. Who's had an eye exam? All of us, right? It's not fun. You have to get dilated. So I'm actually working with a company now that has this really cool sort of kiosk thing. And it actually, believe it or not, is doing AI. You don't have to have a dilated exam, okay? It can diagnose diabetic retinopathy. It can analyze what your glasses prescriptions are, and like all of this, okay? And it's out of this world. And what we're working with now is having those put in places that maybe you weren't typical. Like maybe you go in to get a blood draw and you can get something like that. Or if you lived in a rural community, can you imagine? You'd have to drive like 150 miles to get an eye check. So just really cool things like that. And of course, one of the themes that we're seeing for AI that I really believe in is, because the question we'll get asked is like, where do you use it, right? It's very, very expensive technology. And one of the things that I think is really coming to bear fruit is let's use it in the way we do everything else, usually large volume screening studies, right? Like when do you go to get a mammogram? You do that because it's recommended that every year you have a mammogram. Let's use AI to help breast cancer screening. Like let's not use it for some random other thing that drives up cost. So something like diabetic retinopathy screening is recommended. Let's use it for that, because then we can catch diseases upstream, right? And make people better. Because one of the things we hear all the time is, how do I pay for this? Why should I pay for this? So we have to be consistent about that. So I get to work with a lot of finance bros, as my kids would call them, and kind of explain that to them. Okay, so clinical decision support. I'm not going to spend too much time talking about that, but that I kind of call the holy grail of AI in healthcare. So that means you go to see a doctor, they're thinking, what is this diagnosis? Ainsley's here to see me. She's telling me her stomach hurts. She traveled recently, like, what are the differentials? AI is sort of doing a great job of kind of figuring out what it is. And actually, my Aunt Allison was telling me a story of someone she had read about that, I think you guys have heard this, you kind of go in and you look up and AI comes with some diagnosis, like no one thought of, right? But to implement that so that it's really being used for treating patients in the hospital has a lot of risk. Right. So this is one of the harder things it is to get FDA approval for, et cetera. So, but that's going to be obviously really, really exciting. And I have no doubt that we're going to do well. Okay. So I'm going to talk briefly about this, but this is kind of, I would say, the next 2 or 3 years to come. So operational efficiency, robotics, and automation. And this is kind of just like a fancy way of saying anything that helps hospitals work. And like, I think all of us know, I read somewhere a couple of days ago, there's 250 hospitals in the US that are about to close, like about to close because they're in financial ruin because COVID has left, such a wasteland. It's been so expensive. And so one of my passions is how can we bring all these amazing AI powered tools to these hospitals that actually need help? And so it'll be little things like even just doing medical coding and billing. I mean, we don't need, humans to spend time doing that. Chatbots, I think you guys have seen, there's going to be more and more chatbots. And then, of course, predictive analytics. I'll give you a great example of one we did in Northern California, Kaiser. We developed an artificial intelligence solution that basically, if a patient is in a hospital, could predict which patient was more likely to not do well or to have a really bad outcome in the next 1 or 2 days. And so what would we do with that information? We would have more nurses sort of assigned to them and to make sure that if they went downhill, there was someone who was able to come in and really help, right? So that's a really important thing to do. And so there's a whole bunch of startups in this area as well, which are doing great things. Okay, and this is my last big bucket. This is the one that I'm most excited about. I think all of us should be, although all of them are important. And that's moving towards personalized care and what we call precision medicine. Have you guys heard that? So this is how does AI help with this? So for anyone who's done drug discovery, and both my parents are physicians. I'm actually a 3rd generation physician through my grandfather. But my dad, who I mentioned during church, worked for Pfizer for a while, and I got to spend the summer with him. And, we all love to hate drug companies, right? And how expensive they are. And then all it takes is spending one summer there, and you realize that for every drug that makes it, there were like 30 that failed. And, your dad is working on it for 7 years and was one of thousands of people, right? So no one should feel bad for drug companies. But, so what AI is doing is essentially accelerating that discovery process. So now we can discover more drugs quickly. What does that mean? Not just more drugs, but better drugs. Drugs that are more precise. So, we know thousands of women are diagnosed with breast cancer, but maybe my breast cancer is different from the person next to me breast cancer. So how does that drug then become personalized? And we need to move to that because healthcare is not something where you can just treat everyone the same. But up until this point, we haven't really had the ability outside of, someone's cancer may look different on a mammogram or on a pathology to tell that difference. So we're at a precipice of some really, really exciting things. And I'll talk about one of those in our use case. So just really quickly there was a great finance talk that we had that I came to here for our adult education. And so I just wanted to put in, because I sense I have a pretty savvy crowd. So I wanted to give a little bit of a background. So this is investments over time in healthcare startups. Okay. You can see 2021 was crazy. Why do we think that was? COVID, right? So COVID just led to this huge interest in digital health, everything health. And it's been good. You can see there's been sort of a lasting impact from that. 2023 was a little bit slow. 2024 has been good. And of course, ChatGPT and everything came out in around 2022, 2023. Now this is interesting. So this is just showing all the different areas of investment. So drug discovery, decision risk, some of the stuff we've talked about, diagnostic equipment, even the financial software. So you can see there's a whole bunch of buckets. It's not just simple, right? This is one of the things I love, which is where is all the activity happening for these AI startups? So most of it's the US. This map doesn't break it down. Most of the US, obviously China, as we saw with that, everything recently. England is really big, and Europe. But you can see that in general, it's really a global technology solution, like I kind of talked about. So I can tell you guys, so this is literally like a 64th of the number of startups right now in the space of healthcare AI. There are so many companies, there's so many people working towards this. And I really do feel like my job is to kind of find a little bit of the diamond in the rough and then help them deploy in these healthcare systems who are really overburdened with a lot of things. So this is really kind of interesting. So this is the median post-valuation versus the overall deal size. And you can see in 2025, there's some big things about to happen here. If there's finance people in the audience, call me out if I'm saying anything correct. And this is why. So as exciting as all these startups have been, in fact, if you look at specifically healthcare AI startups or these digital health companies, there actually haven't been that many that have exited or become successful, have gone on the stock market, have made it big. So we're at this point where I'm seeing a lot of startups that are like doing really well. They're actually getting higher and higher valuations, but we saw recently an announcement of one of the first, it's a digital health company in the musculoskeletal space. And they are going to go onto the public markets. They're going to IPO. And I think everyone's kind of watching that with a lot of excitement. Can this make it? And why do we care? Well, we want these companies to do well if we all want to benefit, right? Because if this doesn't start realizing itself, then there may be, I don't think anyone's ever going to leave this field because everyone takes it so personally because everyone knows someone is affected. But it should be exciting. So I'll just close with these 3 use cases. So this was a piece that my team wrote about, which is really about robotics. And I am so excited about robotics, okay? I will tell you guys, it's going to be very likely, and you probably know this, but in the next couple of years, we'll probably start having robots in our home. And I mean like very nice robots that kind of help us with things that are not annoying. And there's some few examples. When you get home, maybe you can Google some. This is one really cute one, okay? This is Moxie. Okay, and she works with a bunch of nurses in a hospital, and she's not doing surgery. She's doing little things that, like, we've all probably seen or know nurses that you're like, that's really not a good use of their time. So Moxie is making their lives much better. And in fact, she has saved over 575,000 hours of work for this team of nurses, like, and others like them. So this is real. There's an amazing hospital in Taiwan that is fully robotic, and robotics are doing everything from analyzing patients, who are under intensive care. It's just the future is now. And so what's interesting about robotics is it's what's called physical AI, right? So AI, we know, we read it, we see ChatGPT. Well, this is artificial intelligence in the physical world, the manifestation of AI. Now, unfortunately, robotics is extremely expensive. So you're only really going to see like the top 4 or 5 tech companies really doing this. Other than a few really successful startups, it's very expensive technology. So keep an eye out for this. I'm really excited about it. We have to make sure the robots don't take over. So that'll be important. But this is a piece that my team wrote on healthcare in the European Union. And I don't know if you guys saw recently, but they made a multi-billion dollar, $50 billion investment in AI in Europe. And this was really big for them. And what's interesting is the US has been kind of poo-pooing the EU. I don't know if some of you guys saw when Vance went and talked to them about sort of their approach to regulation, but it's actually potentially set them up for something that could end up being beneficial. So they have the same regulatory practice against all 27 members of the EU. I still see European startups wanting to come and deploy in the US market, but I think that things are changing, as you know, in many ways for Europe. So I'm actually really, really excited. I think this is it's good for us. I think we need that market to be really active and robust.
Who did you say was making that investment in Europe?
It was through a company called, it was a program called Invest AI. And it was sponsored by the European Union.
It's a private company or is it a governmental?
It's governmental. But they're making it into the private ecosystem, kind of similar to the one that was made here as well. But it was sort of the first time they I thought, matched their money. Like they had been seen as just all regulation. They led with that. But I actually think that was smart, like kind of start with the regulation, then invest in it and kind of help companies deploy.
Thank you.
Yeah. Kind of interesting. And I'll end with this one, which I think one of the things about being in the AI space, it really keeps me humble. Like there's a joke that everyone that does artificial intelligence has imposter syndrome because you just can never keep up. This was just so cool. So NVIDIA, who you guys all know, came up with this thing, an algorithm called Evo2. And what is Evo2? So it's essentially it gives us the ability to analyze millions and millions of genes in like under a second. So this is going to position us to basically start creating, right, going back to that precision healthcare. And so one of the members of my team, this really smart guy, Will, had kind of coined this wetware as a service. So if we could start analyzing all these genes, analyzing all the treatment for genes, and I think many of you heard of that treatment recently for sickle cell, in which now patients with sickle cell do not have that acute pain crisis, right, if they have this. And it was actually developed by a woman. It's called the CRISPR technology, in which you can actually do genetic therapy, right? And so the thing is that was very time intensive. The medication is very expensive. So if we can use something like this to create and analyze and create more and more therapy at the level of the genome, at the level of DNA, something as simple as like overnight, the potential's there. So, I think like this is just one of many sort of use cases, but I wanted to kind of give it to you as food for thought. And I'll stop there and maybe pause, and see if anyone has any thoughts. And I'll just put this out as a starter, sort of conversation starter. If you could solve any problem in healthcare, what would it be?
Sick patients.
Sick patients really don't know what they have. Right. So ideally not getting sick to begin with. Is that kind of what you're getting at? You're saying sick patients are annoying.
I was being facetious. I mean, first of all, I don't know if is it my turn to talk?
Yeah, go ahead. Yeah, this is a conversation. Yeah.
It's a great talk.
Yeah.
And it's exciting. It sounds like you're well into it. I have some questions. You answered one of them, genetic analysis. Now, who puts the data in to be analyzed, whether it's a slide of a specimen, tissue slide, or a genetic analysis? Who puts the data in?
So you hit on probably one of the biggest questions, which I chose not to really talk about, which is about the data. It's all about the data. Yeah. And so there's an expression like garbage in, garbage out with AI. So right, whatever you feed it, whatever comes out, it's going to be that. And that's part of why this huge investment that was announced earlier this year, like what is it going to? Data centers, right? So there's so much data and there's so much energy being required to feed this data. So to answer your question, it depends. So so that's why everything has to be digital, right? So fundamentally, that was a key step to where we are. You can't feed in like pictures of things, right? So it's all digital. A lot of the startups that we're working at, they exist in the cloud, but that brings up other issues of data architecture and then security and privacy. More and more now, healthcare organizations are starting to talk about, should we share data? Should we compile data? Why don't we have the data of everyone in the United States so that we could then accelerate the treatment of disease? But then sometimes you go to the patient and they're like, I don't want my data shared with anyone. But so if it's anonymized in general, there are things like Mayo Clinic has the Mayo Clinic platform. It's all patients that have been to Mayo Clinic, de-anonymized, it's shared with other people. Kaiser Permanente is very guarded about their data. If you're a Kaiser Permanente patient, no one outside of Kaiser Permanente is going to ever see your data. And that's just their sort of the way they operate. So I think it's kind of a personal decision. Interestingly, in Europe, it's generally agreed. Someone told me this from, I think at Luxembourg, that doctors own the data in the healthcare, which I thought was interesting. But a lot of patients feel, of course, they own their own data as well. And so the way it would be fed, so for instance, it's all basically absorbed through the cloud and then uploaded into these large systems, which are, analyzing that information and then processing it in a way. But it's getting to the point, there's something called vibe coding, which my team does. So my firm is AI, as you might imagine, is AI driven. We have a lot of algorithms that we've developed that sort of help these startups determine, what are things I can do to go to market. I don't really go into what we do, but so the way you can code now, there's something that was coined by one of the people who started OpenAI called vibe coding. You literally can just talk to the AI and it will start coding things for you. So it's just like everything is becoming multimodal, so advanced. That kind of starts to scare me a little bit because it's fine when you have people that know what they're doing, but then you have someone sitting somewhere and they're coding for who knows what, that, but I guess that could be anything, right? So did that answer your question? Or did I skirt it successfully?
Good start.
Okay, all right, good.
Well, kind of picking up on that a little bit, the next step. So what I kind of understand with AI and its advantages, and I think you pointed out a number of them, is that it can take reams of data, millions, if not billions of pieces of information, and then put it together. And not just the raw information, but also you can enter in this particular set of conditions led to this outcome, which is very powerful. Okay, and this outcome led to that. And it's all probably statistically based because not every set of conditions leads to the same outcomes. There are different outcomes. So you can imagine the complexity of all of this and the computers using that. And my point of that is, yeah, okay, so it's a huge processing thing, but I also have, and maybe you could comment on this a little bit. When you opened with at that talk or conference you were at, when they set up, okay, all of you that interpret and analyze and, imagery and so on, you're all gonna be out of a job because of AI. I'm not so sure. Artificial intelligence to me is a difficult name because what does the intelligence part mean?
Right.
When I think of intelligence, part of it is putting all kinds of information together, looking at decision trees and so on what possible statistical outcomes could be, much more, and do it in a few seconds or whatever as a tremendous aid to doctors or anybody analyzing things. But I don't look at AI as being creative from the standpoint, not from the standpoint of analyzing and putting things together, but that spark. When I go to a doctor and I say, I've seen stuff, and this most likely would be this kind of situation for you based upon the data that I was able to access to.
Mm-hmm.
However, I'm thinking, and I don't know why I'm thinking this way, but I think you ought to go in this direction versus that direction, if you know what I mean.
Mm-hmm.
So maybe you could comment a little bit on the limitations of AI from the standpoint of we don't need doctors anymore. We don't need human, you know what I'm saying? I'm taking to an extreme here, but there are people that sometimes talk about that and fear that. And I think they're overselling what AI can do in terms of, replicating the brain, the human brain, in its ability to be creative, its ability to out of the box thinking and judgments and so on and so forth. So I'm just curious about that dimension of it, at least from your perspective.
No, such a great question. So what you're talking about is what's called generalized artificial intelligence. So when are machines going to get to the point that they have literally the ability to function like a human? It was funny, about a year ago, that was most of the sort of experts, much smarter than me, were predicting that was maybe 5 to 7 years off. And now I'm hearing that's probably within the 2-year time frame, where it's getting to be that smart. And so I think that in general, like if I were to tell my kids, like, what should I do, right? So we know artificial intelligence is here, it's coming. What field should you go into? I think to your point, anything where the human touch is going to be really important, but also to always know that there's always going to be a role for the human, right? Think of it like any other technology that you've ever used. I mean, people thought when electricity came about that like the world was going to end, right? And it didn't. And so at the end of the day, so I use AI all the time in my work. I've actually found that it makes me slightly more creative and that it makes me think of things I wouldn't have. But to your point, it also spits out the same sort of things every single time. And at this point, you can almost see like whose LinkedIn post was written by like AI. It starts to lose its sort of appeal. I think that in terms of the replacing of people, there's so many systematic barriers that are preventing AI from being deployed in healthcare right now, but also that will make it challenging for something like a machine to replace a human. And I think that's a good thing. But I also think as humans, we want humans. But it's funny how quickly we adjust. Like I was thinking the other day, when you go now into a lot of stores, especially like fast food places, it's all kiosks, right? It's all kiosks. Like it wasn't that way a year or two ago. Now I don't think anything about it. But I think at the end of the day, at least in healthcare, we're seeing tremendous shortages. I'm really excited because a lot of people are saying they're going into healthcare and going into medicine, so that's great. But as of right now, the population is aging faster than like medical schools can graduate people. So I think there's always going to be a role I see it as like a mixture. Like we need a mixture of humans. We work alongside the AIs, they're agents to what we do. But I also feel like the human always has to be at the center. And that is actually the thesis of the European model of AI deployment is human-centered AI. I think we can do a better job in the US of always talking about that. I do think that conversation is happening right now. And there's actually been like labor discrimination, lawsuits, and you have to be really careful what you do because people can get really understandably upset, right? So, okay.
I was just gonna say, following up on that, so you hear a lot about robotic surgery. And so I was wondering how does that work? Because it's a human and a robot, and the robot is AI generated, right? There's heart surgery, there's robotic surgery I've heard, and
So great question. So there's the most common model is like the Da Vinci robot. And I think that that's a good sort of example of what could be to come. So the way it works is the physician, the surgeon who's doing the surgery, first of all, is able to operate a lot longer because they're not using all of their, muscle memory and to do the surgery, and able to do it in much more of a precise way, sort of through the robotic arm.
Okay, so
That's
there's a
doing the
literal
surgery.
robot there.
There's a little robot there. There have literally been surgeries performed in different parts of the world, performed by surgeons in other parts of the world. Because you can kind of act through the robot. That's not that commonplace, but that's probably where we'll
And
be.
that's AI generated.
And there is some AI. It's interesting. So in almost all of the equipment that we use, including most radiology equipment, there's AI that's helping to operate that, but not in the traditional sense. I think when I'm talking about AI, you're sort of thinking about, is autonomous, so the Da Vinci robot is being 100% operated by a human. There's not things that are happening without humans in the loop. But no, it's a great question. It's interesting, actually. One of the other trends that I see really hopefully taking off a little bit more for education is virtual or augmented reality. So I work with the Maryland Institute for Health Computing actually in Montgomery County, and they're doing some really cool studies on what causes VR sickness. So I don't know if any of you have family members that like use those, meta goggles or whatever they are. But, they can make you, some of them aren't done super well, so you can get nauseous. I actually had the chance to kind of learn how to do a surgery under them, and I didn't get nauseous, but afterwards when I took it off, I felt extreme fatigue. And so just kind of working through those barriers, but like a lot of medical schools now, they're learning through virtual augmented reality. And this is a great example, right? How many surgeries do you have to see in order to be proficient? Whereas if our surgeons could be at home watching 500 surgeries on one of these virtual reality, which in some cases they are, that's great. I think it's really great for like training and education and even more simple things like, how do you prevent like a urinary tract infection, right? That has a incredible morbidity and mortality after surgery. So like, how can we train nurses to prevent that? So just kind of a lot of potential, but yeah.
I have a question about quality. So of the techniques that have been implemented, and if radiology is your specialty, if you wanted to talk about that, what quality level or accuracy level from the computer assisted or computer controlled diagnostic and implementation is acceptable and what is seen in reality? Because I know my mammogram statement says on it, it was computer analyzed and reviewed by a physician. It says it every year. And so what quality level is expected from the computer? And then what quality level is expected from the physician? How do you fine tune the ones that should have been kicked out for a reject to be reviewed more thoroughly? I mean, that's one of my questions in terms of my own personal health care.
As well as
and coding too. What percent of coding errors is acceptable if it's AI generated versus what percent does a human get when they do it?
Yeah. So I think a really critical question, especially from like a patient advocacy standpoint. And I think a lot of it, we have those measures, right, in terms of what we expect for humans. For certain things though. So I love the mammogram example because that is a very regulated area of radiology by the FDA. It's through the MSQA program. And so if you do mammograms as a practice, you're required to report out centrally to the FDA, how many positive mammograms do we have? Of those positive mammograms, what percent actually became cancerous? And we provide radiologists back to them, like with feedback on how they're doing it. Actually, there's an expectation that of all the hundreds of mammograms we have, a certain percentage only should be diagnosed. Funny, in Europe, they actually choose to have 2 radiologists read every study. And so that could be good in that you pick up more cancers and you also potentially could exclude more cancers, but they found themselves in a big pinch recently with the radiologist shortage. So they basically had like double the pinch we did. So actually, before I left KP, and they still are working with a company that's out of the UK, that basically is seeking to replace that second reader. So can we replace that second reader of mammograms with AI? But going back to your point about the mammograms, it's so funny, the computer assisted detection, was called CAD. We actually don't even use it in Kaiser Permanente because the reason that it doesn't help in any way to the workflow, it certainly helps potentially pick out more cancers. As a radiologist, do I want 20 circles to pop up of things that artificial intelligence thinks could be cancer? But I know from being a radiologist in 15 years, that is not. And so it kind of shows you that the technology hasn't been that good for a while. And that's part of why radiologists are pretty skeptical, like of many things, because this has been touted to us and it's not that helpful. But I will say we've seen some improvement. And so for instance, the study we're doing, instead of presenting all those circles, it's working behind the scenes and it's actually only sending those cases in which the AI disagrees with the radiologist to an arbitrator radiologist. So most of the time AI agrees with the radiologist, but when it doesn't, let's have an expert radiologist be sort of the person that is the tiebreaker.
When in manufacturing for highly precise functions that are critical, you have to have your error rate in this multiple sigmas away. So, and I would think you would want that in diagnostics.
Yeah.
You might not accept a higher error rate or how many sigmas it should be for coding. And for coding, medical coding for insurance purposes, because you don't want human intervention to fix them. I mean, these are all,
So I wish I put in, there's this great graph that the American Medical Association has, which shows exactly what you're talking about, that mix between high risk and then sort of quality and sort of where do you fall on that? Like Billy might be down here, right? You make an error there, but then something like clinical decision support's way up there because if you mess up, the downstream repercussions can be significant. And so I would say that in general, like that's why I'm skeptical. A lot of companies, they'll say, oh, we have a 99% sensitivity and a 98% specificity. Right. And that may or may not matter. So, but great questions. I don't have a lot of answers. By the way, full disclosure, I'm not going to have answers to most of them.
No, I just wondered if you could comment on what the current rates would be in the most fully deployed. Do you have a good feel on that?
So for anything to be used, the FDA will only approve it if it's at or more than a human. And but the actual rates, but now remember, a lot of AI is not necessarily regulated. So radiology is. But there's some areas that it's not a regulated device.
Well, even in devices that aren't AI, that aren't always regulated.
Right. So we kind of treat AI like anything else. And then it's really up to sort of a research trial and then the hospital making the determination, does this meet standard of care? What we would call standard of care. If you're not meeting a generally accepted standard of care, it wouldn't get approved.
It would never get in.
I mean, it shouldn't get through hospital review committees and all of that.
So, first off, thank you for your presentation. And you mentioned something earlier about bad data in, bad data out. And when all this started, the whole idea was to be able to do machine learning and trend analysis and pattern recognition and those kind of things. And that required an enormous amount of data. So just give me more data. So it became a data monster, just gobble, gobble, gobble. Didn't matter what the data was, just give me the data. Because I want a more uniform perspective of the target, whatever it is. And so as these new AI software and endeavors and so forth are absorbing this data, are they coming up with recommendations of how to change the actual data itself at the onset so that the diagnostic tools might change to provide a more robust data sample? So again, the data piece is so critical, right? And so ChatGPT, which many of us know, was trained on the internet. And we all know that everything you read on the internet is correct. I mean, and talk about like, if you're looking at there's a lot of good stuff out there, but not a lot of good stuff. And so
there's this interesting woman who kind of publishes on just AI and actually how it's really bad for the environment, like in the sense that it uses a ton of energy. Well, the other thing it does is it also, someone has to train a lot of that data, and the people that are training that, it's not
biases.
necessarily, yeah. So, interestingly, there's another big trend that kind of came up this year, which your question reminded me of, is that of agents. Have you guys been hearing about this agent? So an agent kind of functions to make your general model a little bit more special to you and kind of get to your point, like how can it actually help me with my data, right? So it's not just this waste basket or whatever. I find ChatGPT actually extremely useful, but then how can we then train it on a subset of data? And there's a term called prompt engineering, right? And so that's how you're working with the AI bot and you're kind of training it to work. And so absolutely it can get better over time. In addition to garbage in, garbage out, if you ask it like not a great question, or you just ask it something in general, you're going to not get a great answer. Whereas if you can be really specific, so say I'm like preparing a talk theoretically for Potomac Presbyterian, adult education, I could say, help me put together a talk. What should I talk about? And it could give me just like a basket of stuff. But I said, you know what? This is a very well-read crowd. I need to have it like at a higher level. Can you talk about these 3 trends? It's going to then come up with a series that's going to be very different, right? So I think to your point, we're seeing more and more emphasis on that data, but also how we engage with the models that's allowing it to be more useful for more companies. You guys have heard of Salesforce. Actually, this is probably not a good example. I was going to say they're now in the Heathrow Airport, which was now shut down for like 24 hours. But everyone can have sort of their own agent that does their own work for them.
Yeah, but then how does AI help ferret out the biases of the agent?
Yeah.
Because there's going to be inherent biases, whether it's a program, because somebody else programmed it, and they've got biases of what they think they want to see or experience. And then any agent, as you're saying, that's curating the data personally is also going to have some built-in biases,
right? Because
the agent's going to start off with a preconceived potential condition.
100%. And right. Bias is something. Now there's only probably something that's more biased than AI.
And that's people.
Yeah.
People reporting their symptoms and lying.
Yeah, exactly. And so, but no, you're right. And like one of my favorite stories early on was, and I think you guys have seen this. Now there's so much in the sort of way news, but give me a picture of like a room full of CEOs, and like it may or may not look like what everyone thinks that should look like, right? So it's like, where is this coming from? And back to the point about creativity. Actually, I may close here just with this really cool story, and happy to answer any questions afterwards, but that'll kind of, hopefully get you thinking. I don't know, maybe you heard about it. So The Hague recently, I think it was late last year, had to get Girl with the Pearl Earring, had to go on loan. I don't remember what museum it went to. So they asked for submissions for what should hang in the place of Vermeer's painting. And they ended up actually accepting this absolutely gorgeous painting called Girl with the Glow in the Dark Earring. And so when you go home, Google this, okay? AI generated, there was a huge uproar, and the Hague Commission said, we don't care that it's AI generated. Like, this is truly a work of art. It's beautiful. It's going to hang there with the 4 other submissions, and they stuck by it. And so I think at the end of the day, with the creativity and the science, it's going to kind of be something where we're going to have to learn to adopt. So I always used to tell people at Kaiser Permanente, if the Hague can innovate, we can innovate at Kaiser Permanente. But and then my other favorite story was with the Beatles. Did you guys hear when I think it was John Lennon or Paul McCartney, but a song was released and it ended up being, they were able to bring it to life. They've known about it forever, but because of AI, they could get rid of all the other things and they released it. And there was again, like this big uproar, like, oh, this is AI generated, blah, blah. And then the son of the Beatles said, you know what, honestly, like if the Beatles had been able to be around with AI, they would have gone nuts and had so much fun with this. Like if they could have lived through this moment, and like I think my dad actually would think this was really beautiful. So I was kind of like, let's not take it for granted, kind of what we have, because there's a lot of power with it, but we also have to kind of be really respectful. So maybe I'll stop there. Thank you.